Hello, I am Jackson Bates, and this is a video presentation that Alex Fuller, Bianca Villacorta, and I have put together for your convenience to present facts over diseases caused by, in some way, shape, or form, alcoholic abuse. Cardiovascular disease is a class of diseases that involve the heart, the blood vessels, or both. The more severe the drinking problem a person possesses, the more likely a cardiovascular disease will be present. 193.6 deaths for every 100,000 people occur in the United States of America. Watching what you eat, how much you exercise, and how much you weigh can put the brake to cardiovascular disease. Cirrhosis is a chronic disease of the liver marked by degeneration of its cells that occurs after about a decade or more of heavy drinking. Long-term effects include bruising and bleeding of the liver. Around 10 people a year die from this disease out of every 100,000 people within the United States of America. It is fully reversible depending on how long it has been around in the patient, by completely giving up alcohol and by taking medicine to battle some of its symptoms. Dementia is a loss of brain function that occurs with certain diseases affecting memory, thinking, language, judgment, and behavior. The total number of people with dementia worldwide in 2010 was estimated at 35.6 million. Among these, 58% live in low and middle income countries, and this proportion is projected to rise to 71% by 2050. People with dementia are frequently denied the basic rights and freedoms available to others. For example, physical and chemical restraints are used extensively in aged care facilities and acute care settings. People rarely have dementia before age 60, but after age 85, up to half of all adults have dementia. Depression is severe despondency and dejection, typically felt over a period of time and accompanied by feelings of hopelessness and inadequacy. Roughly 20 million people in the United States suffer from depression every year. 1 in 4 young adults will suffer an episode of depression before age 24. Continuous exposure to violence, neglect, abuse, or poverty may make people who are already susceptible to depression all the more vulnerable to the state of mind. A seizure is the physical findings or changes in behavior that occur after an episode of abnormal electrical activity in the brain. There are more than 20 separate seizure disorders. 1 in 10 Americans will have a seizure at some time in their life, and at least 200,000 Americans will have at least one seizure a month. When alcohol is related to seizures, it is often the state of alcohol withdrawal that causes the seizures, not the drinking itself. Binge drinking and alcohol withdrawal can even lead to status epilepticus, a life-threatening and potentially fatal problem. Gout is a type of arthritis that occurs when uric acid builds up in the blood and causes inflammation in the joints. Acute gout is a painful condition that often affects only one joint. Chronic gout is repeated episodes of pain and inflammation. More than one joint may be affected, and alcohol use increases the risk for gout. More than 2 million Americans suffer from gout, most oftenly occurring in men. Men usually develop it between the ages of 30 and 50, and women are more prone to gout after menopause. It is rare in children and young adults. Attacks of gout are unexpected and excruciatingly painful. With prompt treatment, the pain and inflammation usually disappear after a few days, but they may recur at any time. Hypertension, most commonly known as high blood pressure, is when your blood pressure is 140/90 mmHg, or above that most of the time. Aneurysm, stroke, heart attack, and eye disease stemming from burst capillaries in the eye are all possible side effects of alcoholic abuse. 33% of all Americans, 105 million, are affected by high blood pressure, with 18.8 of every 1,000 Americans dying from high blood pressure or complications thereof. It is reversible mostly through dietary measures, i.e., watching what you eat, how much you eat, etc. Alcoholic neuropathy is damage to the nerves that results from excessive drinking of alcohol. The effects of alcoholic neuropathy are many, but they mainly deal with mild failure of the muscles, such as difficulty urinating, muscle cramps, muscle weakness, numbness in the arms and legs, etc. When affected, likelihood of death is extremely low, but major disability throughout life will remain. Damage to the nervous system is largely irreversible and will most likely only get worse as time goes on. Anemia is a condition marked by a deficiency of red blood cells or of hemoglobin in the blood, resulting in pallor and weariness. Long-term effects include fatigue, pale skin, brittle nails, and dizziness. Every 1 in every 200,000 individuals in the United States die from this, and is reversible in most cases by taking iron and vitamin-enriched supplements and foods. Pancreatitis is the inflammation of the pancreas, most often caused by alcoholic abuse, with 45% stating that is the original cause. Symptoms include upper abdominal pain, fever, increased heart rate, nausea and vomiting, and a swollen and tender abdomen. However, it affects only 0.03% of the population of America, so fear of the disease, while it should be present as an acknowledgement, should not be great. Pancreatitis from alcoholic abuse is largely reversible so long as the patient in question avoids drinking for at least 6 months' time, if not more. Again, this has been a short review over alcohol-related diseases by myself, Jackson Bates, Alex Fuller, and Bianca Villacorta. Thank you for listening.